Good morning. Thank you for still keeping us company. Now we shift gears from looking at stories that have been making headlines in the last 24 hours and we focus on matters of health. So today we're going to be talking about cervical cancer. And I know what you're thinking. Well, we have done this over and over again. Well, we learn every day. So today we're joined by Dr. Arogo Rita, who's a resident obstetric. OB, we call them an OB and gyna at the Kenyatta National Hospital. To avoid, you hearing how heavy my tongue is, we all know we come from the people of Mbas. So our tongue is rather, heavy. So let's go with an OB and a gyna at the Kenyatta National Hospital to just take us through this conversation. We want to know, how do we prevent the issues of cervical cancer? And if you get that diagnosis, how do you, continue living a healthy life? Good morning.
Good morning. How are you?
Yes, fine. Definitely your tongue is not as heavy as mine. Maybe you can just you can reintroduce yourself instead of saying an OB and a gyna.
You did well. My name is Dr. Arogo Rita. I'm a resident in obstetrics and gynaecology.
See?
Yes, at Kenyatta National Hospital.
See? I knew your tongue was not as heavy as mine. Anyway, good to have you. Good to have you on
Thank
Health
you.
Tuesday.
Yeah.
And I'm very happy because we've been making fun with my colleague here that girls run the show. So my guest happens to be a lady, so we're like, yeah, whoop, whoop. It's just another day where we tell them that we run the world. Yeah. We'll be running the city soon. Now, how do the numbers look like currently as far as cervical cancer is concerned?
Locally, the latest data we have is from 2018, which says out of 100,000 women, 33 have cervical cancer. And out of these 33, 22 of them die from cervical cancer in Kenya. Yes. Globally, we had 500,000 deaths by 2018. 500,000 new cases by 2018 and 400,000 deaths, yes, by 2018. Cervical cancer is the fourth leading. It is in the world, but it is the second in Kenya amongst women after breast cancer. Yeah. So it's pretty common. Yeah, it's pretty common.
Now, talking about common, when I'm looking at the math, I'm doing it. Are we doing, that's around 70-something, 70%.
Yeah.
That's quite a number.
That's quite a number.
So then what do we do about it? What can be done about it? In as far as prevention is concerned, what are the outward symptoms first, and what can we do to prevent it?
Okay, maybe we can talk about what we can do to prevent it, and then we discuss the symptoms.
Yeah.
What should you look out for?
Yeah.
Yeah. So in preventing it, we do vaccination for girls between the age of 9 to 14 years. We do vaccination, and then that's called primary prevention. So under primary prevention, we also encourage condom use. We also encourage sexual education. Yes, appropriate for each and every age set. Yes, and also we discourage people from using tobacco because that's a huge risk factor. We also encourage people to delay their sexual debut. That's the age at which they start getting sexually active. Yeah, now that's primary prevention. Secondary prevention is where now we get involved with the pap smear. For women in the reproductive age between 24 to 69 years, we recommend pap smear as a screening tool so that we pick it very early. There's what we call precancerous lesions. So that is the stage before it converts to cancer. If we can pick it through the screening early enough, we would have prevented the cancer itself. Then there is the tertiary prevention, where now we treat you. We offer you treatment that can be curative or can also be palliative. Yeah.
Ooh. Quite heavy there. Let's go back in time. Just a few minutes. You've said the primary, let's start off with the primary prevention. You've said you're talking about a vaccine as well as use of condoms and, age-appropriate sexual education.
Yeah.
Let's talk about the controversial vaccine there, because we've heard so much about this issue of the vaccine.
Yeah.
From a doctor point of view, from a doctor point of view, a gyna point of view. Is this the safest way we can do it? The age of 9, when you say 9, everyone goes that is a child, Help us go through that, or rather understand that.
The reason the age is put at 9 to 14, and this is a globally accepted range, this is not just Kenya, it's because the sexual debut, the age at which the girls start having sexual intercourse is getting younger and younger. So the average age is about 10 to 12 years. Yes. So then when WHO picks 9 to 14, that's an attempt to get these girls before they are sexually active, because the most common way of transmitting human papillomavirus is sexual intercourse. So the whole point of this young age is before they become sexually active, let's vaccinate them. Let's get it before they get the infection, the HPV infection. Yeah, that's why it's at 9. I know it sounds young, but
oh yeah, it
by
sounds
9
young,
years,
and
some
even
girls
when that
are
came,
active.
When this conversation came about, the church was totally against it, saying that the children are too young. Does it mean now that we vaccinate them, we've given them a license to continue having, or rather to begin having sex? There was that conversation.
Yeah,
From a
I
doctor point
remember.
of view, from a medical point of view, make us actually help us debunk this issue, this myth around the HPV vaccine.
You see, when you say they're 9 years and they're young, I totally understand. From a parent's perspective, I have nieces who are that young. And from an aunt's perspective, I feel it's not too young. There are so many controversial issues around it. It's like we are encouraging them to have sex, which is not the actual thing. Because you remember, like I said, in the primary prevention, we also have age-appropriate sexual education. So we are trying to encourage them and say, in as much as we are giving you the vaccination at 9 years, it's not like we are saying go there and be sexually active. Because one of the prevention measures is delaying their sexual debut, delaying the age at which they start being sexually active. So by giving them the vaccine, as doctors, as healthcare workers, we are not saying, okay, now we are giving you the go-ahead to go have sexual intercourse and get the HPV virus. No, we are saying this is the average age at which majority of the girls start becoming sexually active. And if we can vaccinate you before you become sexually active, that would be better. Because as you understand, majority of these girls will be sexually active without even the parents knowing. So by the time you're realizing your girl is sexually active, maybe you're realizing when she's 18, when she's 16, when she's open with you, but probably she started at 10. So if we can pick this age group that is still in school, that is still young enough before they become active, then that's better. So that's why we pick the age of 9 to 14. And yes, I encourage my nieces to go. Yes, I do. Yes.
That's a brave move. That's quite a bold move there. And do you have conversations with your nieces to just make them understand what type of shot they're getting and what benefit will it have to them? Or you just tell them you're going to have a jab? Do you?
No, no, you actually need to explain to them. You know, we've come to a point in life where you don't underestimate what these children are able to understand. It's not like the era in which we grew up, in where you're told we are going to hospital and it's your mom who explains what's happening to the doctor. You're all quiet at the corner. No. You need to explain to them. And I explain to my nieces, the reason why we are getting this is because we are preventing something bigger. We are preventing some illness. So it's the same way, I tell them, it's the same way you get other vaccinations when you're young. When you're still an infant, less than 2 years old, you go for your regular vaccination, 6 weeks, all that. So it's the same thing. We are trying to prevent something bigger. And I tell them this bigger thing is cancer. And I try to make it as simple as cancer is something that if we don't treat, can be very dangerous. So then if we can prevent it, that is even better than waiting for you to get it, then we treat it. Yeah.
Now, Daktari, the issue of affordability of this particular vaccine, what is your take in regard? Because the issue of affordability, especially in as far as medicine is concerned in the country, is something of concern, of great concern, because it's far from the reach of a majority. So, is there a way we can make it more affordable, or government can make it more affordable for majority of Kenyans? Because we've already said that the statistics are speaking for themselves. Yeah, affordability.
I know it's a huge concern, but then it depends with where you get your vaccination from. From government facilities, it is highly subsidized. I wouldn't say it's free, but then it is highly subsidized. The government has also taken up responsibility and once in a while organizes camps, yes, where we do large-scale kind of vaccination of these girls. So then if people can take up such opportunities, but then you can also get it in the private sector if you want to, for the added advantage of the private sector, your privacy, the shorter queues and all that. If you want to go to the private sector, it might be slightly costly, but you can get it there. But also in government facilities, it is highly subsidized. So you can either take advantage of the camps when the government rolls it out for free on a large scale to the school-going girls, or you can also come to public facilities. It's highly subsidized. Yeah.
On average, in a government facility, on average, how much does it go for? On average?
That is a tricky question because it also depends on the type. You know, there are different types of the vaccine. So let's say about maybe 2,500.
The different types of the vaccine. How many
Yes.
times actually should you be vaccinated, or should a girl this age, let's say girl X, at the age of 9, how many times? And how many times? You just said that different types.
Yeah, so you need to do it twice. Between this age of 9 and 14, you need to get the jab twice. WHO is saying the recommended dosage is twice while you're still within this age group.
9 to 14.
9 to 14, yes. So then the different types, it's just, it's a matter of the industry manufacturing it and also the type of HPV that's covered for it. Now, you'd understand that HPV, human papilloma virus, has more than 100 types.
Strains, yeah.
Yes, and 14 of them are the ones that cause cervical cancer. But then 70% of cervical cancer is caused by type 16 and 18. So when I say different types of vaccines, it's the type of HPV that is in them, that it's vaccinating against. So all of them have 16 and 18 because that's the main thing, right? So they have 16 and 18. Then they'll have additional, depending now on the type of the virus, they'll have additional viruses vaccinated against, because others cause anal warts, yes, others cause anal cancers, penile cancers. So then depending on the range of the human papilloma virus that is covered in that vaccine, then you get to have different types of vaccinations. Yeah.
Goosebumps. Okay. That's why we never made it to the medical field. It's just, now let's look at this other level. You know, you said secondary?
Secondary prevention?
Yes, yeah. Secondary prevention. And this is where we're targeting adults. Basically, this was sexually active from the age of 24 to 69, as you mentioned. So, pap smear. That is very intrusive, and I'm wondering when the medical fraternity is going to get another alternative of, you know, screening other than just pap smear. Why does it have to be a pap smear?
We do pap smear because it is highly sensitive. Yes, as a screening tool, it is very specific and very sensitive. I know you have the option of doing HPV DNA, but I can assure you majority of us will turn positive for the HPV DNA.
When you say us, you mean women?
Yes, women. So majority of women will turn positive for the HPV DNA. Remember, almost everyone who's been sexually active has probably contracted this virus at some point. It's just that when your body, your immune system is very competent, when the body has a way of clearing this virus from your body. Yes, so then when we say HPV DNA as an alternative, the specificity and the sensitivity is low. So the pap smear becomes the next best alternative. It is actually recommended by WHO that we do pap smear for the women in reproductive age. And it will pick it faster. It will help us prevent these precancerous lesions. And if we pick it faster, then we reduce the disease burden and eventually reduce the mortality. Yes, I know it is invasive. I usually tell my sisters, look at it this way, like you're going for an IUCD insertion.
But
more or less the same.
The people who don't
try IUCD. No. I know. So it's more or less the same procedure. We have a look down there with what we call a speculum. We visualize it. It's not painful. It might be uncomfortable for some people, but it is not a painful procedure. And then we just take a brush and just get cells from the cervix. And that's all we do. We don't pinch you. We don't. It's not painful, but some people may consider it uncomfortable.
It is uncomfortable. I am on the uncomfortable camp.
Okay.
How often do you recommend that one goes for a pap smear?
For this age group, reproductive age recommend every 3 years, but I would say that is dependent on the results of the first pap smear. Because based on the results of the first pap smear, then we can tell you if it's normal, we tell you come after this duration, which is on average 3 years. If it's not looking good, but it's still not something that has turned into a precancerous lesion, we can make your visits a bit more frequent. There are people we tell to come every 6 months. There are people we tell to come after a year. Yes, so majority of the people, we do it yearly for the first 2 years. Then after that, we tell you to come after 3 years. Now, of note is if you have HIV infection, then we do it yearly. Yes, we do it yearly. We don't give you the leeway of 3 years. Because remember, majority, if you have a woman who has cervical cancer and HIV in the entire world, you'd be surprised that more than 85% of those women are in sub-Saharan Africa who have both cervical cancer and the HIV. HIV actually increases your risk of getting the cervical cancer. So that's why we encourage you, if you're HIV positive, then your pap smear tests are usually more frequent than the other person who is not HIV positive. Yeah.
And on that note, we will be taking a short break. When we return, we're going to be having our doctor this morning just sharing more of what we need to know to prevent cervical cancer, looking at the issue of, cervical cancer is, quite prevalent in the country. Looking at the statistics there, we're looking at around 70%. And the latest statistics that is based on the WHO survey of 2018 indicates that 33 out of 100,000 women have cervical cancer. And 22 of them out of that sample size do not survive. We'll be taking a short break. When we return, we'll still continue discussing this issue.